Well, thank you for giving me the opportunity to share my work with the UAS great team. I want to share with you one of the areas that I have been working lately, which are community-based digital interventions that they are target. The ones that I'm going to share with you today are mostly target to Latino communities in Los Angeles area. And the two programs that I'm going to share with you are about digital programs that try to have an impact on financial behavior and health. I guess next slide. Oh, we have this. Oh, thank you. Okay. So here, right, so as I say, these are community-based digital interventions, which means that I work closely with community organizations to find what type of programs the community need. And I see digital technologies as an opportunity to really engage immigrant underserved communities, right, to have access to information and promote behavioral change. And I had the opportunity to work closely with the Understanding America study team, because for this program, and this is a little bit different from what we have been talking about the whole day, because I use their platform, but I recruit my own participants. So I work with community organizations, right, to devise, to design, implement, and evaluate digital programs that try to meet the needs of the community. And my programs, I like to say, are all about access to information, especially because I work with communities that have important informational barriers. For example, their digital literacy levels are lower. They also language barriers. My programs are always created in English and Spanish. And also another important piece of this work is motivation, right? It's not only information, but motivation. And that's how you get behavioral change happen. So first I want to share with you, again, this is very general presentation. So please reach out if you want a more specific information on these digital programs. So Mind Your Money was a financial capability program designed to improve money management skills among the Latino population. And what we did for this project, we collaborated with two community organizations in East Los Angeles. And it was a 6-month digital program where participants will receive one text message per week for 6 months. And this program was created using a curriculum from the CFPB, the Consumer Financial Protection Bureau. And then also the way that we kind of create this curricula is that every week participants have to do something different. Like 1 week, they have to read about information. Another week, they have to do a tool, for example, about financial plans, right, or financial goals. And then another week, they have to reflect and take an action. And then another week is what we call the money diary. So we ask participants to keep track of their income, expenses, savings, and debt in a monthly basis. So here we use motivation, right? So we give them access to information of how to improve how they manage their finances, but then also provide encouragement for making the change. All material available in English and Spanish, and we had around 125 participants. So here, how do we evaluate the impact of our program? We design it as a randomized control trial with a waitlist control group. So when you do community-based research, it's very important that you try all the people in the community to benefit from your program. So having a waitlist control group really allows you to do that, which means you're going to measure the impact of your program right before the control group gets exposed to it. And we do a difference in difference regression analysis. And the main primary outcomes that we look at is the financial capability score, the financial self-efficacy, and then also we look at financial stress. So another thing we really wanted to look in this study was the relationship between finances and stress. So here, just sharing with you some of our results. So here we found that our program was effective improving the financial capability score. We find, if you are familiar with that score, it has 6 components there. And it might be a little small for you to read, but it was very interesting to see that when you look at the financial capability score, the 2 main parts of where our program was the most effective was on having a budget and a spending plan, which kind of makes sense because every month we actually ask them to fill out our survey online in the platform to talk about, what is their income, expenses, debt, and savings. And then also, we also see that participants were more likely to meet an unexpected expense, which was, we really emphasized in our program to increase emergency savings, right? Our program was very basic, right? I like to call it, it was really designed for low and moderate income households. And these were some behaviors that we really wanted to change and help. And then the financial self-efficacy score, we didn't find a significant effect, but we do find that our program was helpful reducing financial stress. So we have the results that I'm sharing here is from a very simple measure that asks, did you experience any financial stress in the previous month? I think the Financial Health Network uses a similar question like that one. And we find that our program actually helped reducing financial stress in the previous month. So here, again, so just summarizing, we were very excited to find that our digital program had this positive impact on financial capability score and then also on financial stress. It helped reducing financial stress. So then the other program I wanted to share with you again, really quick, is Mi Vacúnale. So this program was created to improve vaccination rates among Latinx children. So this program, we created this program because at the time we've been working, I work with people from UCLA with a family doctor, and we realized that there was very little information that really target children at the time, and also very little information in Spanish. So here we created Mi Vacúnale. We went in the field twice. So for this program is similar but different. It is a 1 month digital educational program, right, where participants receive 3 text messages per week. So one, they have to watch a short video, 2-3 minutes. In the next text message, it takes them to read some information, where later we created some audio files. We really wanted to serve, low literacy families. So we thought the audio files for the information they have to read will be very useful. And then we also have infographics that we hope that they were easily kind of capturing the material for that week. Again, we created the curricula based on the experience of the family doctor, who was my collaborator. And we really wanted to meet the needs, the informational needs of the community, right, to increase vaccination rates. So here I'm going to share with you the results of our Mi Vacúnale 1.0. So we were in the field in the summer of 2021 with 366 participants. And then we also were in the field in the summer of 2022, right? What makes this very interesting is that when we were in the field in 2021, if you have children, you might remember, but at that time, the vaccines were only available for 12 to 17, right? So, and then in the next summer, when we were in the field, the vaccines were now available for 5 to 11. So it was very exciting, right? And we really wanted to target those groups. So here it's a very similar design. We use a randomized control trial with a waitlist control group. Again, we want everyone to benefit from our program. A difference approach, and the primary outcomes that I'm going to be talking about are mainly from the first time we were in the field, when the vaccines for the 12 to 17 were available, but not for the other younger cohorts, right? So here, what we find that our program increases vaccination rates among 12 to 17 years old children. And then we also find that our program increases the willingness to vaccinate children between two years old and 11 years old. At that time, we weren't sure how vaccines were going to be broken down by the different groups. So here, what we find are effects of a large magnitude. If you're familiar with vaccination, like how to move vaccination rates, a lot of people were very impressed. Again, one limitation is that our study is all self-reported, but it was very interesting to see, that we actually found that by being exposed to our program, we see an increase in vaccination rates for children 12 to 17 years old by 15%, and then the willingness to vaccinate children 2 to 11 years old by 12%, which are huge effects if you are familiar with the vaccination literature and interventions in this area. Again, we believe that one of the reasons is that we're working with a population that has important informational barriers, and our program was really addressing that. So here, just to conclude, right, I really see the opportunity of digital technologies as an effective tool to engage hard-to-reach communities. I'm very thankful to the UAS team to have been working with me in these community-based digital interventions. I feel that it is a great opportunity to reach to people who really don't have access to information, and then also to provide motivation for change. And it's a very effective and efficient way, right, to conduct a randomized control trial in the community, right, that focus on behavioral change. And yeah, I think I'm good in time, right? So thank you.